Vanakkam. Welcome to this course on classics in neuroscience. In this series of videos, we've been focusing our attention on learning and memory, the work of Donald Hebb, Brenda Milner and Patient H.M. In the last few videos, we focused on the limbic system. Specifically, in the last video, we focused on the amygdala and the seminal work of Paul MacLean in using focal electrical stimulation to demonstrate the functional relevance of amygdala in our emotional experience. In this video, we continue our discussion on the limbic lobe, but we take a brief detour into studying the memory and hippocampus. So, in this video, we will focus on the memory and hippocampus. We will focus on patient H.M., who is arguably the most famous patient in the history of neuroscience. Anyone who is a student of neuroscience will be able to recognize who is H.M., what was the problem he had. And the neurosurgeon who performed this surgery on H.M. that led to making H.M. so famous. Rather, the surgery was performed by William Scoville, and that surgery essentially led to a sort of devastating memory loss in H.M. that made H.M. a very famous patient. So, there are three main characters in this dramatic story. The most important, of course, is patient H.M. He is considered the most famous patient in the history of modern brain science because he lost the ability to form new memories, a problem that is called as anterograde amnesia. He also suffered retrograde amnesia. We will come to the detail in a bit. Then his neurosurgeon William Scoville, who performed the surgery that removed the hippocampus of H.M. that led to this form of devastating consequences for patient H.M. and Brenda Milner, who was a psychologist who performed many interesting experiments with patient H.M. Essentially, her entire career, I think, she published so many papers involving patient H.M. We discuss how these people came together and how the studies on patient H.M. improved our understanding of memory. So, H.M. was born in 1926 in Connecticut. He was having a relatively uneventful, normal, healthy childhood until about 9 years. When he was 9 years old, he got into a bicycle accident in which he probably had some head injury, and he fell unconscious for a brief amount of time. From that time, he started getting minor small seizures, occasional minor small seizures. This was continuing for another 5-6 years. He started getting major seizures, the grand mal seizures, at about age 15. And the seizures kept on increasing with age. The seizures became more and more frequent. He could not really go to job really. He was having frequent seizures at job twice a day. And at the good old days, the only drugs that was available was narcotics. The only medication that was available. It helped to some extent. The problem is that it completely knocks the people out. It makes the person very drowsy. Also, the narcotic drugs were addictive. So, because they were addictive and they made the person very drowsy, that essentially meant that H.M. could not go to work. He had to stay home and just be under medication. That was his daily life. This was around the time when his family discussed with the doctors as to what can be done now. William Scoville was trained in medicine. He was a neurosurgeon. He started studying the neuroanatomical aspects of frontal lobe removal, for example. So, he studied a chimpanzee, Becky, whose frontal lobes were removed. This was done to understand decision making and intelligence, done by others like Carlyle Jacobson. As reported by Kluwer and Boosie, what was found was that Becky became very docile and pleasant. Earlier, she was easily frustrated and vicious. She could be very easily frustrated and irritated. She will start, becoming aggressive initially. But this surgery made her very docile and pleasant and calm. These results were dramatic because the behavioral change was dramatic. This essentially suggested that frontal leucotomy, that is, leucotomy means technical term, removal of white matter, that is what it means. Removal of white matter means cutting, undercutting the fibers, and full frontal lobotomy, the entire frontal lobe is removed, that is called full frontal lobotomy. This was considered in treating psychological disorders like schizophrenia and depression and other such things. Scoville was still an undergraduate at Yale. He studied medicine at Penn and trained in neurosurgery in Harvard and in Baltimore. And he practically started the neurosurgery department at Hartford Hospital. He was also involved in psychosurgery when H.M. was brought to him. We will discuss the details of psychosurgery in later videos in later weeks. So, H.M. went through an EEG and no abnormality was found in his EEG. So, during the surgery, it was found that a small part of the hippocampus was observed to be atrophic, suggesting that there was degeneration within the hippocampus that may be part of the disease. So, it was believed that this degeneration in the hippocampus may be due to the pathology, and there was removal of bilateral medial temporal lobe resection. This surgery essentially involved removal of hippocampus, entirely, practically the entire hippocampal formation, parahippocampal gyrus, or what is the equivalent of entorhinal cortex, and amygdala. This is what was removed in the case of patient H.M. So, yeah, most of the hippocampal formation, the neighboring parahippocampal gyrus or the entorhinal cortex and the nearby amygdala were removed. Like any other patient, H.M. also recovered, so there was no big difference in the way in which H.M. recovered. But it quickly became apparent that H.M. had acquired anterograde amnesia. That is, he showed an inability to develop or form new memories. These symptoms are very similar to Korsakoff syndrome found in severe alcoholics. These people are not able to form new memories. That has nothing to do with alcohol itself, but due to a vitamin A deficiency, unrelated to this topic. The point is that H.M. developed anterograde amnesia, showed a severe inability to form new memories. H.M. also had retrograde amnesia for up to 3 years before the operation. So, he had no clue what happened 3 years before the surgery. Also, he was not able to form new memories. That means that even if he met somebody just a few minutes ago, if that person shows up again, he says that he has never met this person previously, and he was genuine about that. It was not like he was acting, it was genuine. He could genuinely not recognize a person whom he had just met just a few minutes ago. So, this brought in the need for a psychologist. William Scoville started scouting for a psychologist. This essentially started the scene or set up the scene for the arrival of Brenda Milner, whose work we discuss in the next video. So, in this video we looked at the story of patient H.M, what happened to patient H.M, and what was the surgery that was performed on patient H.M, and the surgery that was performed by William Scoville, who was the surgeon who performed this surgery on patient H.M, and also that Scoville felt that there was a need to bring in a psychologist to study patient H.M, because patient H.M had developed anterograde amnesia, severe anterograde amnesia. So, he was scouting for this psychologist. That is when Brenda Milner enters the scene. Her work we study in the future video. Thank you for your attention.